Dr. Tang, welcome to Live from Bed.
I'm so excited to be here. Thank you so much for having me.
I have to be totally honest, you guys. I'm going to hijack this episode because Dr. Tang, I need to tell you, my period is late. And it's never late. So I want to get into that in a second.
Of course.
But Dr. Tang wrote a book that absolutely changed my life because, as you guys know, family planning is on my mind. Being a woman just in general is on my mind, and wondering what the hell is going on down there, and wondering, based on the age I am, like what I need to worry about, what I don't need to worry about, what's wrong with me, what's right with me. You know, we just have all these questions. But Dr. Tang's book is called It's Not Hysteria. Everything you need to know about your reproductive health, but we're never told. I mean, I think I pretty much understand. If you've ever been on Instagram or TikTok for 10 minutes, you understand why it feels hysterical. But why did you call it It's Not Hysteria?
I mean, I just love this title because it captures so much. I think just like the experience of being a woman and just trying to navigate your body, your health, all the misinformation out there, trying to figure out the healthcare system and, trying to get people to take you seriously for concerns. I mean, it just captures everything. And so, in the book, I have chapters on like literally every topic. So, your periods, birth control, fertility, miscarriage, vaginal health, bladder stuff, and all of the different topics like endometriosis and menopause and things like that. So basically like anything that anyone with a uterus has like ever gone through, had a question about, wondered if it was normal. I try to kind of fit it all in there so you could have a guide to all of it. And it's throughout like your whole life too. Like, you may be a teenager and have very different concerns than somebody who's going through like menopause, for instance. And so just, whatever phase of your life you're in, that you would find the answers that you're seeking. And, I actually have a chapter on history. Is the word hysteria like has all these like historical connotations. It literally, either used to mean that your uterus, the word hysteria comes from the word for uterus, actually. That's, you may have heard the word hysterectomy.
Right.
So it actually literally comes from the word for uterus. Like,
no, that blew my mind.
Right? That they thought it was your uterus was like literally misbehaving and like wandering around. And then you had Freud later, who was like, oh, hysteria is just because you're like anxious and you're suppressing all these crazy anxieties and that's what's making you sick. So all of that stuff is still a little bit present in how women are treated these days. And so, they may have lots of physical problems and then get told, oh, you're just anxious or that's just periods. Where in reality, there's, maybe a medical thing like endometriosis or PMDD or PCOS or something going on. So, I just thought it was important to capture that. And, I say in the beginning of the book, it's not an encyclopedia. Like it is a bunch of facts, but it's also about like what someone's experience is. It's like the process of like living in a female body and like what struggles you may be going through and what questions you may have.
No, it's so approachable.
Yeah. I tried to make it so it wasn't just like dry facts about the uterus. Yeah.
Totally.
So, yeah.
But even as we're sitting here right now and you're talking about what's in the book, like I must have highlighted and starred and folded pages over and over and over again, but I
love that.
I was flooded with questions. And like, I think, I've been lucky in some ways to be able to kind of avoid my reproductive system up until this point, other than the fact that I had periods and things like that I just knew nothing about, because truth be told,
we don't learn about that
we
stuff.
learn nothing. And then you just finally like get to this point where like either something's wrong or you feel a certain way and it might be linked to that, or you just want to start family planning and all of a sudden you're supposed to have all this information.
Right.
And what I keep running into in this like family planning time in my life is that there aren't many studies done on pregnant women or about women and their menstrual cycles or reproductive system in general. So much of the feedback that you get, even if you go to a good doctor, is like, well, we're not entirely sure about that.
Yeah.
Like little things. Like I asked my therapist if I could be on my antidepressant when I'm family planning, or if I should go on fit before or after, or like if I can stay on it, if I need to go on a different one. Like those questions, it's so frustrating that there isn't a cut and dry answer.
Yeah. I mean, the subtitle of the book is Everything You Need to Know About Your Reproductive Health, But We're Never Told.
Yes.
And I was doing a talk and they blew my mind a little bit because, she said at one point, like, when we do whatever small amount of sex ed that we get in school, it's always about like preventing danger. Like it's like don't get an STD, don't get pregnant if you don't want to, but nobody talks about like how to actually like achieve the good goals. Like, how do you get pregnant if you want to, or like you're having sexual, like, problems with like libido or orgasm. Like, how do you improve that? Like, how do you have a satisfying sex life? And it just blew my mind because you're like, you're absolutely right. It's the way it's framed in just how people talk about reproductive health is always like avoid bad stuff. It's not like how do you like understand your body so you can achieve your own goals and things like that. But real quick, I'm not an obstetrician. I don't take care of people in pregnancy, but in general, like, antidepressants, most of them you can stay on. We want people to, like care for their mental health as well as their physical health. There are a few antidepressants that they do take people off of because there's a potential for things like birth defect type things, but that's rare. So it is something that you would, talk to your OB before you're trying to get pregnant. And they would, if you need to switch to a different class, then they'll work with your psychiatrist to change that, or your primary care, whoever. So, very important to know, like, it doesn't automatically mean that you have to stop it, like that there are many of them you can continue. So.
Well, what that reminds me of is theoretically, when you want to start trying to have kids, you have to be prepared for it to happen tomorrow, or for those lucky few,
or a year from now.
2 years from now, you know? So I'm like, that whole thing is just such a mind fuck, let alone the lack of information that we have and or are taught. You really start from ground zero, and then you learn so much. And the whole time, all I hear everyone say over and over again, whether they've been through IVF, surrogacy, any of it, I wish someone had told me. So like this book is such a saving grace, because I also feel like so many of our listeners and myself, we're at this place in our lives where it's not just, like we're at the age where we want to start having kids. It's not just that. It's that you actually start to be like, okay, as a uterus bearing person and someone who menstruates, why do I feel shitty for a week and a half? You just are more curious about your body and what's happening. And then your mind is blown when you realize, like, oh, I'm not crazy. I can have an orgasm this way. This isn't abnormal. And it just feels like you're right. We're just fed this pretty sterile, don't do this, don't have sex, don't get pregnant. And then you just have to flip the light switch, like when you're like ready for action, and you don't know anything. I feel like they think if they teach you, then you're gonna, I don't know what.
Yeah. There are so many things I didn't learn until I was like an OBGYN resident. I was like, really? Like what? And, I try to put some of that in the book because there's so many things that, I'll say it on social media. People are like, well, I had never heard of this before. But it's just about like how things work. Like, for instance, that, sperm can live for 5 days in the body.
Yes.
So, sometimes like people think like, oh, if I avoid sex on the day I'm ovulating, that's all I need to do. But no, they can live in there for 5 days and you could get pregnant during a time that you don't want to. The other thing is that the egg only lives for 24 to 48 hours. So again, same idea where, we're taught in school, like, oh my gosh, like you have the sex like one time, like you can get pregnant. Like, well, that's possible, but it has to be during that time that the egg is actually released and still alive. So people don't realize that they only really have like maybe 2 truly fertile days per month. And if they, miss that window, then they've missed the whole month. And so there's so many of these little things about just how the body works that no one teaches you. And then people are like, oh my God, I wish I had understood this about my own body. And that was like the mission behind the book, is just hearing this so often. People are like, I wish I'd known this like a year ago, 10 years ago, 15 years ago. I would have done things differently, or, I wish I had understood what's going on with me more. And I think everybody deserves that. Like, we should understand how our bodies work.
No, I really feel like you must have been on vacation with me and my husband last week, because I was trying to explain this to him. It was like I was explaining quantum physics. I'm trying so hard to be like, well, theoretically it could happen in these 2 days, but the sperm could stay alive. And it was like mayhem. So while I think that every woman in the world, every person should read your book, but every man who's married to a woman, like needs to have this information.
Oh my gosh. So whenever I see, and I'm very flattered when people say like every woman should read it. I'm like, I think everybody, like men should read it, because so many of the things in the book are not just about women. It's, for things like birth control, fertility, miscarriage, abortion. Like there's all these topics that really impact everyone,
Totally.
So, even if you quote unquote don't have skin in the game, but, it's important for people to understand.
An orgasm is skin in the game.
Yes. Sexual dysfunction, pelvic floor, like these not gendered issues. And so very important. Here's another fun fact that a lot of people, their minds are blown. When you see on like TV shows, they're like, oh, I'm ovulating, like now's the time to have sex. if you have sex when you ovulate, it's actually too late because the sperm can take a couple of days to get to the egg. And by then the egg could have already be like basically breaking down. So, when you see on the TV shows, it makes it like, oh, honey, I'm ovulating. And like that, you're like, that's the moment. It's actually in real life, like that's too late. So the ideal time, the reason that ovulation kits, a lot of people don't know this, the ovulation kit isn't saying that you're ovulating. It's detecting a hormone that goes up before you ovulate. It's a signal to your body that then later will lead to ovulation. And so that's when it's ideal to have sex, is when that spike goes up. And then it gives the sperm time to get to the egg. So a lot of people don't realize that. They're like, what? They think that the ovulation kit is telling you you're ovulating. It's actually not.
You need to have sex that day. You need to have sex 48 hours
before. Exactly.
Wow.
I know.
Wow.
Yeah. I didn't know that until I was a resident. I was like, wow, okay.
That is so crazy. Because what really blows my mind, I'm thinking from just personal experience. I got pregnant in my senior year of college and I had an abortion, but I was like, it just goes to show it's so crazy that you want to not get pregnant so badly at one point in your life. And then you want to get pregnant so bad and you really learn how hard it is and how fertile you must be in those young years of your freaking life.
All the stars aligned so perfectly without you knowing it.
Jeez Louise. Yeah. No, that's crazy. So like I said, I am late on my period, but I don't know. Sometimes the apps I feel like overreact a little bit. I don't know that I'm like 5 days late, but I'm usually never late. And I just turned 30. And first of all, I want to get into fertility just in general, because that's what 99% of the questions that our listeners asked were about. Everyone wants to know if and when I want to have a baby, how do I do it? So a late period, what could that mean?
Yeah. So it's so funny. I was just recording another podcast and that's literally one of the questions they were asking about themselves too. I was like, oh, no way. Like the question of the day. Yeah. So in general, the way that it typically works for a period, there's a whole cascade of signals that go from your brain to your ovaries to your uterus. And that is what is required to make you ovulate. And then ovulation leads to your period later if you don't get pregnant, obviously.
Right.
So there's a whole cascade of different signals that are required to make that happen. Anything that can throw that off can make your period late. So if you don't ovulate, you're not going to get a period or it's going to be delayed. So in the book, I talk about, the reason that is when you release an egg, you get a little thing called the corpus luteum that releases a hormone called progesterone. The drop in progesterone when the corpus luteum breaks down is actually the signal to your body to make you bleed. Okay. So if you don't ovulate, then you don't get a period. And so sometimes people are like, well, I know I'm not pregnant. Where's my period? It's just probably that you didn't ovulate or you ovulated later than normal so that the period is going to come later than normal. And a lot of things can do that. Basically anything that affects your body. So that could be stress. It could be physical illness. Like if you get sick,
so having your house robbed, theoretically.
Right, yeah. It's not major life events.
Yeah, sure.
Do it. Yeah. But a lot of people probably realize times that you were super stressed out, your period could be really wonky and unpredictable. People who are athletes, you may have heard that people who are training a lot, exercising a lot.
Gymnasts and stuff.
Yes, exactly. Gymnasts, professional athletes, they may not have periods because, the signals are so thrown off by the strenuous exercise. So yeah, there's a bunch of different things. I mean, different medications can do it, all sorts of stuff. And obviously hormone issues like thyroid problems, PCOS is a very common one that makes people skip their periods. So it could be a lot of things. But in general, if you're usually my period's super, super on time and, 1 month it was weird, usually there was something that month that kind of just threw your body off a little bit. But obviously if it's still irregular, still missing, then weeks go by that, please see your gynecologist. They'll do some hormone tests.
Well, that's what I was going to say. So first of all, you don't even understand how many questions are running through my mind. I just feel like this is my one shot to get all these questions answered. Yeah, I'm so excited. So theoretically, just speaking as myself, I get my period every 28 days, 30 days. I'm clockwork. I've always had a super regular period. How many months of an irregular period can you have where you maybe stop being able to detect stressful things that are happening or, other reasons why it might be late? When should you go see your doctor?
So in general, we say 1 month might be, okay, that was weird, things happen. But once you get to the second month, then we're maybe go get checked out. Sometimes too, it just takes a long time to get in with the doctor. So, if you're heading into the second month and things are still, either missing, you still haven't gotten a period 2 months later, or it's wonky for 2 or 3 months, definitely make an appointment and see. It may not necessarily be that there's something super wrong, but, you can at least get things started tested, like, check your thyroid, check some of these, hormone tests to make sure. I was going to make a little caveat about checking hormones, because sometimes people will ask, like, at what point do I need to check hormones?
That was going to be my next question.
Like, I got you. Yes. So normally, like, we don't need to check hormones as often as people think we do. So a lot of times people say, well, I'm feeling kind of off. Like, should I check my hormone balance? We don't typically check for that, because the reason is that your hormones actually change like day to day and like hour to hour. So there's a normal pattern where, like, certain hormones go up, they go down. So just kind of getting like a random hormone level doesn't actually really tell us much. Like, almost always it's in like a normal range, and we're like, it looks normal. So it doesn't really tell us anything.
Can I be honest? I went to the doctor and I got my stuff checked.
Yeah.
And they came back and said it was normal.
Yeah.
And I was like, I've never hated being normal so much in my whole life.
So that's what we tell people. It's like, I can almost guarantee it's going to come back normal. It doesn't really tell us anything. And so the times that we do test are, number one, for fertility. If someone's been trying, regularly and they haven't gotten pregnant for a year, for like 12 months, if you're under 35, if you're over 35, we check after 6 months, just because we want to kind of get things rolling sooner. So, 6 months if you're over 35, 12 months if you're under, or if you are skipping periods, like there's something where we're like, well, let's just make sure that it's not something unusual like early ovarian failure. And that's pretty rare, but just to give the example, or to check your thyroid, to check your testosterone, to rule out PCOS. Like, if you're having other symptoms that could suggest a hormone issue, like a thyroid problem, PCOS, like, so if you're having like skin changes, weight changes that are unintentional, like we'll use some of those clues to tell us to check the hormones. And then obviously, like, if you're showing signs of like premature menopause, like, you're in your 30s and you're having hot flashes and missing periods, we will check then just to make sure. But but like, just in terms of like people being like, I just feel like a little off, like, like that sort of thing, we don't typically, because almost certainly it's going to come back quote unquote normal. So
right. So is there any, just to go back to the late period of it all, because I don't know, my intrusive thoughts are winning today. Is there any world in which maybe just my cycle's getting longer because I've just turned 30? Is there anything that's related to age?
It can, yeah. Sometimes as people get older, the cycles can change a little bit. It's more noticeable when someone's like firmly in kind of like a perimenopause, where it's like, your cycles are getting longer, meaning the time between periods is like noticeably longer on a regular basis, or you're skipping entire periods. Again, or if you're having other symptoms of that. Like, I don't think that's what's going on with you, but sometimes like people are like in their late 30s, 40s, and they're like, oh, like I'm skipping, like things are a little bit off. I feel a little bit hot flashy. I feel a little bit like my sleep is off. Like, those are kind of like, okay, maybe there's like a perimenopause happening. But if you're like, no, I feel exactly the same, nothing else has really changed, it was just like one weird month, like that definitely happens. That's actually pretty, common. Very rare is it someone who's like rock solid, like 28 forever for like, their whole reproductive life. Like, usually people have like at least like one cycle here or there. That's like a little strange. So that's what I'm saying. Like, we don't sweat it if it's like 1 month, if it's kind of staying that way or super weird and irregular for more than 1 month, then we start checking things out. But just to reassure you that it's very common for people to have like a strange month here or there.
Okay, good. That makes me feel so much better. I'm so glad I talked to you about this. These are just also questions that come up for me and my friends at dinner. Is PCOS a box that you can check and say, I don't have? I was tested at 15 and I don't have it. Or is it something that you can develop later in life?
Yeah, people can develop it later. It is, PCOS is always a very hard one to explain, because it's not like there's one gene, one test that says, yes, you have it, no, you don't. It's actually, polycystic ovarian syndrome. It's a group of symptoms. And sometimes it makes no sense. Like, one person with PCOS can have super different symptoms than another person with PCOS.
Which makes it so hard to diagnose.
It's very hard, yeah. So you only have to have 2 out of 3 things to be called PCOS. One is polycystic ovaries on ultrasound. And what that is, people think like big, huge cysts, like water balloons. They're actually super tiny. They're basically follicles of the eggs that are developing in your ovaries. People with PCOS don't tend to ovulate regularly. And so they get all these follicles that are like trying to get released, but they can't. And so they become visible on ultrasound. They almost look like a little, we call it a string of pearls. So you see like a little like ring of little black dots like on the ovary, and that's the polycystic ovary. Number 2 is missing periods or very infrequent periods. So if you're skipping periods, And that's, again, a sign of the problems with ovulation. And then the third is signs of too much testosterone. So cis women who have like facial hair, acne, body hair, that sort of thing. And then it doesn't actually necessarily mean that your hormone levels are abnormal. So that's, again, it's a little tricky because you could test the hormones and it could be completely normal testosterone levels, or it could be high. Just having the signs of you're like, oh, I got a lot of cystic acne. I have to like shave because I got a little bit of like a facial hair thing. That counts. And so you only have to have 2 out of 3 of those things to be called PCOS. So you can have PCOS, but not have polycystic ovaries, which, again, it was a very poorly named condition.
Jeez, yeah.
Yeah. And it's also very associated with what we call metabolic issues, which is like diabetes, insulin resistance, high blood pressure, and cholesterol. So it's a whole body thing. It's actually not just like, a period thing. It also affects metabolism. People can gain weight and have difficulty losing weight.
That makes total sense.
Mm-hmm. Yep.
Wow.
They even tell people to manage it like pre-diabetes, and that actually seems to help some of the hormone imbalance. Some of the diabetes medicines like metformin and like the GLP-1 medications, like the Ozempics, are used in these cases, not, specifically for the PCOS, but, they do seem to improve the PCOS.
I know a lot of people that have gotten pregnant on,
Yeah, exactly. Yeah. The Ozempic baby phenomenon.
Mm-hmm.
And the reason is oftentimes if people fix the insulin aspect of things, that normalizes your hormones and you start to ovulate and have periods again. And then you can get pregnant without intending to. And so that's the Ozempic baby phenomenon. People who are like, oh, I was told I couldn't get pregnant, when they go on these medications, then they actually normalize all their hormones and they start to ovulate again. And also, just FYI, some of them actually do impact the effectiveness of birth control. And so I forget, like it was at Mounjaro. I have to look it up. We'll, look it up for the show notes. But I think it's Mounjaro. One of them actually does potentially make your birth control less effective. So it is one that you'll have to be careful, look at the packaging, talk to your doctor about if you're on something, whether, you should use a backup birth control method.
Oh, interesting.
Yeah.
Okay, that's fascinating.
Learn all sorts of stuff here. Yeah.
I am learning so much. I'm so excited that you're here. Okay, so just around the PCOS question.
Oh, by the way, it is Mounjaro. I was looking it up. Yeah. So
is it? Okay, great.
There's an impact on gastric emptying, the things moving through your stomach and stuff like that. So it can decrease the effectiveness of birth controls you take by mouth too.
Wow. That is insane. Yeah. Okay. So about around PCOS and just your periods in general, I just see a lot of rhetoric online about what makes an irregular period, right? And I think that's goes to show you also just how little we were taught in school.
Yeah.
But what makes an irregular period? Because what I hear most of the time is that it's a certain amount of ounces, which I don't know anyone that's ever measured their blood in ounces, so, okay, I lose there. Yeah. Or your period's especially painful. And I find pain to be a subjective term.
Right.
So it's how do you know? They're like, oh, if you're laid up for 2 days and it's but maybe you just feel more tired. What is too much of both of those things?
Yeah. So when we talk to somebody about their period, we look at a couple of different things. So usually when we say irregular, most people are thinking of the cycle, the regularity of when it comes, how often it comes. So in general, 21 to 40 days is normal. So if you're really short, 2 weeks, or you're really long, 6 or 8 weeks, then those are where we're okay, that's a little abnormal. Again, it doesn't count if it's just one time, but if it's, on a regular basis, you're irregular. And then in terms of the amount of bleeding, you're right. Nobody measures it in I always see things in textbooks as cc's or milliliters. I'm nobody knows what a
Let me get my weight out, my scale out, I don't know what to do.
Exactly. So we usually reference the number of pads or tampons you are changing in a day. I'll usually say on your worst day, how often do you have to change your pad or tampon when it's soaked, or how many are you using? Or if you're using a menstrual cup, how often are you having to empty a full cup?
But then the sizes come into factor, right?
Yeah. So most of in general, most menstrual cups are meant to be last basically a full work day. You should be able to go the work day or the school day without having to empty it. If you're having to empty it 2-3 times a day, that's a lot. And for pads and tampons, for like a regular size pad or tampon, if you're soaking it and having to change like every hour, that's too much. Or like also if you're passing big clots, like if you're having to wear a tampon plus a pad or having to wear two pads together, like then you're like, okay, this is a lot of bleeding in general. If you're planning your life around the bleeding because you're like, oh my God, I'm just going to bleed through my clothes, I don't want to go out. Like anything like that, like those are also clues. It's not just the amount of products you're using, which obviously is important, but also if you're like, your life is revolving around how bad your periods are, that's not normal.
Okay. So like 2 maxi pads in a day during a 12-hour period.
Oh, that's very light. Yeah, that's fine. Yeah.
Okay.
So most people, it'll be like 3 to 5, and then, as long as it's not that like every hour, 45 minutes, you're like, oh, it's soaked again, I have to change it. Like that's too much. Or, if you're using like the ultras and like, you're like, what? Like I just put the ultra in and it's already filled. Like that's, way too much. So.
Okay. I have a confession. I do the diaper situation. I'm like team diaper, and I will tell it to everyone in the whole world.
Yeah, you don't have to worry about leaks.
No, it's the best.
Yeah.
Sorry, do you have more?
Oh, and in terms of pain. So because pain is subjective, I just say if it's affecting your quality of life or keeping you from doing the things that you want to do. So if it's keeping you from going to work, to school, if you can't have sex, you can't exercise, that's too much pain. Or if you're having to just like constantly be taking pain medication, like highest ibuprofen dose around the clock just to function, that's too much. So any of those things are things where you should say, okay, I need to talk to my doctor. And if your doctor's like, that's just periods, then see another doctor. Because that happens. People will finally go for help and then they'll be told, oh, that's just periods. And they don't do any other evaluation or talk about endometriosis or fibroids, adenomyosis, anything else that could be going on, which all of those things can cause painful and heavy periods. Right. So, definitely see your doctor. If you're not getting help or they're being dismissive, then try and get a second opinion from. So my specialty is minimally invasive GYN surgery. Because we specialize in stuff like endometriosis, fibroids that sometimes need surgery, then we also are more like kind of pain specialists too. So you may need to like search around for somebody who specializes in some of these conditions if you're getting dismissed by a general doctor. Lots of general OBGYNs are great, but there are definitely people who are like, I saw like 2-3 OBGYNs. I saw them for 5 minutes and they were like, it's fine. And I was like, I'm still in debilitating pain. What's going on? Those are the times you're like, yeah, maybe I should see a specialist. So.
Okay. No, that's the best answer I've ever gotten for that. Because I'm like, because I feel like everything, I'm like, I don't know, is it too much? Is it not too much? I don't know. Like, I'm not in anyone else's underwear at the end of the day.
Yeah. I mean, nobody knows. Like, how would you know if you're not a gynecologist?
And you say my period's bad, that one person's bad could be one person's light,
Right.
So it's hard.
Exactly. And I always tell people this, and it kind of blows people's minds, is that problems like endo and fibroids and things run in families. So then what happens is that every woman in the family only has a certain frame of reference for what periods are supposed to be like. So you get families where they're like, oh, like everyone is just pouring out blood and horrible pain, but mom, grandmother, sisters, cousins, everybody's like that. So they're like, I guess this is normal. So you get people who, don't get diagnosed with fibroids until they're literally like hemorrhaging in an emergency room. Like they are like, by the time they're like, okay, this is not right, they're like getting a blood transfusion. Yeah. They're in an emergency room and they're like, oh, did you know you have fibroids? So, it's tough because again, like you said, like, how would you know? Like if your mom tells you, well, no, actually I was like that too. And, I was missing school and throwing up and that's just what women go through. Then it gets like this myth kind of gets perpetuated because, if people are so reluctant to like share this stuff, like, it's not like you're having like lots of conversations with like everyone around you about this.
Right.
I think we should, so that we normalize this and then we know. But because people are typically like reluctant to like talk about their periods or pain or bleeding, a lot of endometriosis is associated with like bowel stuff like diarrhea. So like nobody's going to be like, oh, guess what, guys, I'm having like horrible diarrhea and like hemorrhaging today.
Right.
But we should be able to talk about it because it gives the sense of like, it's embarrassing, it's shameful. Right. And then, it's very Emperor's New Clothes where everybody's like, oh God, I can't talk. And then when people finally talk to each other, they're like, do you have that too?
Totally.
And everyone realizes that we're all kind of going through similar things. And why did we feel embarrassed in the first place? But it does lead to this like, delay in diagnosis, people not realizing that it's abnormal.
Totally. I think we absolutely, first of all, need to stop like hiding our tampons and pads when we go to the bathroom because it's serving no one. And just need to like have more of these conversations because you're right. By the time a lot of people get diagnosed or they figure it out, it's when they're hemorrhaging or, you know, like any of them. So I totally agree with you. But speaking of things that are hereditary, we got 3 or 4 questions that were, is fertility hereditary?
So not that I can kind of specifically think of, like things that can affect your fertility are. So endometriosis and fibroids are the big ones. About half of infertility, like kind of unexplained infertility cases in women are related to endometriosis, and that does run in families. Okay. And then fibroids definitely run in families as well. So, you know, this is where, again, like when you kind of ask your mom, your grandmother, like you'll get this kind of like mysterious history, like, yeah, like everyone had trouble getting pregnant and like, you know, so-and-so had miscarriages and then she had a hysterectomy. And that's typically the story, is that that's what you'll hear. They're not going to say like, oh, grandmother had endometriosis. They'll be like, she had trouble getting pregnant. She had a few miscarriages. She like had a hysterectomy. No one knows why. Almost certainly she had either endo or fibroids, you know, so those sort of things do run in families. And infertility specifically for other reasons, I don't know that that is the case, because, you know, it's either usually related to, you know, if not something structural like fibroids and stuff, you know, maybe egg quality or, you know, ovulation or hormone issues, you know, sperm issues. About half of cases of infertility are related to the male in some way, either the male alone or the male and female both have some sort of factor. So a lot of people don't realize it. You usually think of infertility as like, oh, it's the woman's body. But about half of the time it's something to do with the male, which makes sense, you know.
Yeah,
they're like half of the process. But a lot of people don't realize that.
No, because they get away with everything because no one's telling them they need to modify their diet or any, you know, like when we get shamed for like everything we're doing and we think we're at fault or we're broken.
And then the other thing that is inherited is the age of menopause. So for instance, like if your mother went through very early menopause, like, you know, at age 40 or 30 something, that increases your risk of having early ovarian failure as well. So that is something also that runs in families, is that like, if, you know, if mom had a very early age or grandmother, whoever, that their ovaries were quieting down, then that is also a little bit of higher risk for you. And so those sort of things are inherited, which can affect fertility.
Okay, because I can't tell you how many people in my life, like I'll say, oh, I'm afraid that I can't get pregnant because I don't know about everyone listening, but I have this gnawing anxiety that comes at 3 a.m. that like, what if? And every time I say it to someone, they go, oh, your mom had 4 kids. And I'm like, I'm pretty sure like that. I don't know. It just never eased any of my nerves. So, and okay, but let's dive into that intrusive thought. This ovarian failure is giving me tremendous anxiety. Oh, no. What is that?
Yeah, and it's really rare. So like, you know, just to kind of put your mind at ease again, it's not a common thing. Oftentimes it's increased risk with things like autoimmune disease or like, you know, somebody had cancer and had like chemotherapy. That's usually where it happens. Like someone with like a young breast cancer who went through chemo, that can put them into early menopause. It's very, very rare for someone just be like living their life and then go into early menopause. Like that's pretty unusual. Okay. So it's usually that there's something else going on. You know, again, the more common risks are like autoimmune diseases and also some exposure like a chemotherapy, radiation, you know, and or if there's like a family history of like early ovarian failure. But if you're just like, again, like living your life, you've had rock solid periods like your whole life and it's just this one time, like you're not in early ovarian failure. So just a, you know, put your mind at ease.
No, that really helps me because I was about to take that thought to my shame spirals at 3 a.m. Is there any world in which, and like what could be the cause of this, where someone, they try IVF and everything, is there any person that just can't have kids?
There are sometimes, and you know, the good news is obviously a lot of times IVF is very successful, especially if you're younger. The times that it may be more difficult are if there's like an egg quality issue, which tends to be more like as you're getting older. Like this is where when someone is, you know, into their 40s, that the fertility doctors may recommend something like a donor egg, because just like the egg quality has gone down to the point that they're like, oh, you know, like the embryos aren't really viable, or they've tried a couple of transfers and, you know, like it hasn't stuck. So again, just for listeners, if they don't know, women are born with the eggs they're going to have their whole life. So unlike men who make new sperm all the time, yay for them. But like
Assholes.
women, you get the pool of eggs you have your whole life, and the pool just goes down. And it goes down with age. So that's why it's harder to get pregnant when you're, say, obviously like 48 compared to when you're 18, is just the egg number goes down and the quality goes down as well. So, fertility gets harder. And then there's also increased risk of things like miscarriage and Down syndrome. It doesn't like plummet off a hill right away. People think of there's like certain age, like 30, 35, where it like plummets. It's not like that.
I'm like, yeah.
No. It's gradual. The time that it starts to really kind of like go the wrong direction is like in the 40s. Like then it pretty rapidly kind of changes. But otherwise it's a gradual thing. It's not like that there's like a moment where you're like, you've missed your chance.
Right. It feels like that.
Yeah, it feels like that sometimes. But it's not, in reality, fortunately, it's not like that. But that does make it harder as you get older. So it is something that's why we have the earlier, the over 35, under 35 guideline, because if someone is, like where every month is going to maybe make a difference in the fertility, like we don't want to make you wait extra time before we start doing testing. But somebody who's young, who's under 35, it can just take a long time to get pregnant. And that's why we give people 12 months, because again, you only have like that very short fertile window. You might have missed it.
Yeah.
Who knows, like that egg may have, just that egg may have been a dud, so the stars really have to align. And that's why we usually say like it can take a full year for, even if there's absolutely nothing wrong at all, to just make it all happen, the timing just to work out. So, but there are some people who, they go through all the treatments and the IVF and it just doesn't work. And it's very unsatisfying because obviously you would love for there to be an answer, but a lot of times there just isn't. There's not like, there's a reason why it didn't work. It's just, it didn't work. If it's not something clear, like the egg quality issue or like, like a really severe sperm problem, something like that. And
so theoretically, when you get tested for the first time, if you have a partner, it's probably a good idea to get them tested too.
They should,
right?
yes.
Okay, because they're lazy sperm.
Yes, exactly. So the male partner will always get tested as well. So their part is easy. They just give a semen sample and they look under the microscope and that's it.
And they have a great time doing that.
I know. Yeah, good for them. But for women, it involves like hormone testing. They also will check the tubes. They usually will do some sort of a dye test or like an ultrasound, something to check to see that the tubes are open, that the cavity of the uterus is normal. So there's a couple of different tests for women that are a little bit more, like less straightforward than just giving a semen sample. But both the male and female partners will get tested just to to see what the issue could be.
Okay, great. Yeah, because I've had some people come on the show who aren't doctors and have just had anecdotal knowledge. One person said that they went to the doctor. I mean, I think they actually were over 35, so that could have been a part of it. But they were like, oh, and they found out I had like 2 eggs left. And I'm like, that, like I just can't hear stories like that. Like I'm so freaked out. But I guess what I'm trying to get to and what you did answer for us is like, when should you get tested? When should you know about all this stuff? Because there is that small window of it being like too late or being too early also. Yeah. So it's hard.
And I'll say the caveat to the 6 month, 12 months wait is if something else is going on, like missing periods, if you have signs of PCOS, if you're having really painful periods, because endometriosis can affect fertility as well, because it can cause tubal scarring, it can inflame your eggs and affect the egg quality. So if there's something else going on, see the doctor sooner. So you don't have to wait 6 to 12 months before getting checked. If you're like, oh, I'm skipping a bunch of periods, they're really painful, like that should get checked out right away. Because we also want to prevent problems too. Like this is, why people like me and other endometriosis specialists and advocates are like, get checked early, talk with your doctor. If you have really painful periods, if you're having weird bleeding, if you're having horrible diarrhea with your periods, anything like that, they could all be signs of something like endo. We don't want it to like be there going on and on for years and then, maybe cause scarring and fertility problems. Better to kind of address it when you're like 17 and you're young and maybe there's like a few spots of endo we can remove pretty easily surgically, rather than wait like 15 years. And then by the time you find it, it's like it has caused, damage. So like I said, the 6 month, 12 month guidelines for when do you get fertility testing done if you haven't successfully gotten pregnant on your own has the caveat of if there's something else that should get checked out, check it out as soon as you can. And then in terms of, for people who may not be ready to actually try to get pregnant, but are worried about it, they're like, I know this is really important to me. I want to preserve my fertility, but now is not a great time to be pregnant. that's where we have like the egg freezing question. So, it allows you to get eggs, kind of freeze that time that we mentioned, like kind of keep the passage of time from affecting those eggs and keep them in, that state until you're ready to try and get pregnant. So a lot of employers now have some, the big employers like your Googles and stuff like that, like have great benefits where they can actually pay for egg freezing. And it's because they want their employees to stay in the workforce. They're like, you're at the peak of your career. Yeah. We want you to stay, freeze your eggs so that you can take care of that later. So it's something worth looking into what that option would be if that's your situation. You're like, I want to really take control of my fertility. I don't want to lose my chance, but I know I want to wait 5 to 10 years. That's where your egg freezing kind of comes in.
So with egg freezing, I think like the biggest question I have is because you are taking eggs out and you have a finite amount of eggs, does that make you less able to get pregnant? I hate to use the word naturally. Does that make it harder to conceive through sex?
It doesn't impact your pool that significantly because, in general, like during the years that we're talking about, like 20s, 30s, you have like hundreds of thousands of eggs. So it's not like you're, when you said that you only have 2 eggs left, we don't know.
No, I literally thought I had 14 eggs left.
No. Okay. So yeah, there's like hundreds of thousands, usually hundreds of thousands.
Oh my God. Okay.
So when you said that your friend had a test to tell her how many eggs, there's something called antral follicle count, which is an ultrasound where they count the follicles. It's not telling you like literally that there's like 10 eggs left, but it's just like it's like a marker of about how many, like, so they're not going to tell you, oh, you literally have 10, so, but it's just, yeah.
You just changed my life.
Oh, good. I'm glad.
No, I was completely under the impression that you had like 16. And every time now I have anxiety when I have a period. I'm like, no, that's one gone.
Oh, no. Like people start out when you're born with like millions, and then by the time you get to like your fertile years, it's hundreds of thousands. And then like it does go down over time. But yeah.
I'm so embarrassed because I literally would say to people like, oh, thank God for all the years that I was on birth control. I'm not anymore. Because I was like, oh, I saved all those eggs. That's probably like 5 eggs of, okay. Sorry.
No.
Moron.
And, and you're not necessarily, obviously you're not going to have like hundreds of thousands of periods. So it's not like most of them are going to be released. It's just that over time they'll break down and your body will reabsorb them. And the ones that get released. So, but just the point being that if you do egg freezing and you take out like 10 eggs, it's not going to be like, oh, I've like depleted the pool for later or anything like that. It doesn't. That
was worth having this conversation.
Oh, good. I'm glad.
Oh my God. I was like, I had no idea. Okay. So just another big fear that I think people have is people that have had abortions like me. I had a surgical abortion, however many years ago that was. I can't do the math. And I had one doctor mention super flippantly, like they were sending me out the door and they were like, oh, there might be scarring that could prohibit you from getting pregnant, but we won't know until you try.
Oh gosh.
And I was sent packing. And I am just like, I don't know what that means. Is that possible? Is that reversible? Like, how do I know?
That's also pretty rare with just one abortion. So in general, whenever we consent people for surgery, we have to mention like, what are the theoretical risks? And when you have a surgical abortion, usually people are using suction. Like it used to be like back when I was training, like we had like kind of rigid instruments and stuff and would kind of do like a scrape. And like now we're, careful about that because of the scarring. So a lot of times people would do abortions with like a little suction canister that just kind of pulls the tissue out. So, because there's a risk of causing scarring if you're really aggressive in scraping. So most people with like, 1 or 2 abortions is not going to get major scarring. And so it is something that we tell people, if you had like an infection in your uterus, like that can increase risk of scarring. So if you had say a miscarriage, you had an infection or an abortion and it became infected, you had the D&C, the surgery plus an infection like that, we're like, okay, that could increase the risk of scar tissue. The part of the testing that we do for fertility is to check, I just mentioned, check the cavity of their uterus, and that is to check for scarring. So we usually do either an X-ray with dye that shows us that the cavity looks like a normal shape. It's not kind of in a weird shape because scar tissue is blocking stuff off. It shows that the dye goes through your tubes and they're open. There's also special ultrasounds that are done by putting like some water into the cavity that fills it so you can see that the cavity is a normal shape. So, and you can also literally put a camera in called a hysteroscopy and look in the cavity and be like, yep, looks normal. So there's plenty of ways that we test and make sure that there's not scar tissue. But just put your mind at ease, like most average people who just had like an early abortion, like maybe, 1 or 2, like if you have like 5, it may be different, but, 1 or 2 abortions, no infections, the likelihood's pretty low that you're going to have such bad scarring. It's going to like take away your fertility. But if you're concerned about it, like there are pretty easy tests that can be done to check the cavity. So, I don't do the x-rays and stuff because those are usually done by a radiologist or fertility specialist, but I can do the procedure with the camera. Just look inside with the camera and you can tell. You're like, that's a beautiful, normal cavity. There's no scar tissue. So, if that's a worry of yours, you can always talk to your gynecologist about some of these tests, just to put your mind at ease. But
okay, that really just gave me years on my life.
And all these things too, like the book has chapters on infertility, the fertility workup, like what do we do? Like how do we test all this? And so it is, it's all in there because people have questions. They're like, what does that entail? Like, what does it mean to check your fertility and that sort of thing? So.
It's like this weird world that we don't, you don't know. Speaking of, how often, because I just hear everyone in my life has a different answer. How often do you think people should get pap smears?
Oh, it depends on the person. So there are guidelines that are general. And this is, usually like if you're in your 20s, just to take a step back, what is a pap smear? Some people may not know. So pap smear is a test for cervical cancer screening. The cervix is just the opening of your uterus. So, when we look inside the vagina at the very end of the vagina, there's it looks like a little donut. It's just like the opening that leads into your uterus. And the pap smear is just taking a brush and just touching the cervix to just kind of get some of the cells so we can check to make sure they look normal. Cervical cancer is really kind of a public health breakthrough, area of public health breakthrough because it has a precancerous form that you can detect way before usually you get cancer, and you can kind of treat that to prevent cervical cancer from forming. Also, more than 99% of cervical cancers are caused by HPV, which is a sexually transmitted virus. There's a vaccine that that prevents the most dangerous types. So between the vaccine and getting pap smears regularly, you could in theory prevent basically almost all cervical cancers. That's just the spiel about what a pap smear is. So the frequency that you do them depends on your risk for cervical cancer. So for instance, if someone has an immune issue, so their immune system is weakened by a medical condition or by medications that they're taking, we might do them more often because, if they have an HPV infection, which most people will at some point, by the way, 3/4 of people will have it.
If you've lived, you've had it. Yeah. I had one of those ones that went away after 2-3 weeks or whatever.
Yeah, most of the time, it goes away. You don't even know you have it. So just to say that most people, if you're sexually active at all, will have it at some point.
Or you go and get it.
Right. Yeah, it's out there. But if your immune system is weak, you're less likely to get, to clear it. So you do have a higher risk. So we might do them more often for those. If we find that you have an abnormal pap or you have HPV, then we'll do it more often to kind of keep an eye on it until you clear it. So the general guidelines for someone who's never had a problem before is in your 20s, you can do them every 3 years. Once you're 30, we do check for HPV. We don't typically check in your 20s because so many people have it. We almost, it doesn't matter as long as it's not making the cells look abnormal. But once you get to 30, because fewer people have it, we do start to check. And so the people who have it, we do watch, once a year, we check the PAPs and kind of follow it until it goes away. And so the other thing to make people aware of, because people hear this be like, oh, great, I don't have to go to the gynecologist for 5 years. It doesn't mean don't come back. It just means that one test, you can skip a few years in between. So we do want to see, because we're still doing breast exams. We're still talking to you about periods and, fertility and birth control, all these different things that we're still managing your health for. I always tell people you're more than just a cervix. We're taking care of everything else, in terms of
t-shirts
everybody. Yeah. We're not just a cervix, we're not just uterus. So still see your doctor every year, or obviously, if you have a problem, see them sooner. But the PAP, that one test, can skip a few years. The caveat is a lot of gynecologists will use their judgment. If, say, someone has, multiple partners, they could be exposed to new HPV strains. So obviously, if you have new HPV exposure, that could be very different. And we want to catch that sooner. So a lot of us will be like, yeah, you've had a new partner. Maybe we should do one. It's been a year, or it's been 2 years. If you're having weird bleeding, if you're having symptoms, and even a lot of primary care doctors get this wrong, because they're like, oh, you don't have to have a PAP for 5 years, but the patient's bleeding like crazy. I'm like, we should still do a PAP. We should still check because the guidelines is for someone who's completely not having symptoms, is very low risk. If that changes, then we're like, we should check that cervix just in case. So especially if someone's having, say, bleeding with sex, that is a sign that maybe there's some abnormal cells of the cervix, just by the way. So if someone's having strange bleeding with sex, weird discharge that they've been tested for other things yeast and BV and it's all negative and we're not sure where all the discharge is coming from. So anything that we're like, we need to kind of figure something else going on in there, we might do the PAP sooner. So that's just the PAP guidelines. But just to say, keep still going once a year or going regularly because we are looking at other things. A lot of people think that the PAP is a test for everything, and it's only for cervical cancer screening. It's not checking your ovaries, the rest of your uterus, the vagina, anything like that.
Okay, that is very good information. So just back to the family planning, I think a lot of people listening are turning that corner and just thinking of if they even want to have kids or not, and just want to have all the options possible. Most of the time I talk to people that are pregnant about pregnancy, and I very rarely hear about like their pre-pregnancy life. Not in general, I just mean like more so like what they did to get there. Like everyone has a different potion and combination of things that they think got them pregnant, or none of that. So I guess I wonder a couple things. Like I think a prenatal, a lot of people say you can start like kind of whenever. CoQ10 and everything like that. Like how long does that actually take to make a difference? And if you had full control of when you had a kid, how far before then should you start taking those things?
Yeah, the one thing that has like good data behind it is like the prenatal vitamin, and that is for the folic acid portion of things. It prevents birth defects like spina bifida. And when you see on social media, and there's so many videos about this, I don't know why, about like influencers with their own like prenatal and like supplement lines. And they use a different type of like, like something that's not actually really been tested. So there's a lot of obstetricians on TikTok being like, just do folic acid, just do the cheap over-the-counter version as folic acid. And that's all you need. And so in general, we tell people like maybe 2 months before you're starting to try, because it can take a little time to kind of build it in your system. So if you can plan that far in advance, sometimes people find out they're pregnant and they weren't taking prenatal vitamins. Just start it when you find out that you're pregnant. But if you're planning, start, if you can 2 months before you're going to start to try. The other things are, and I don't have much data in terms of like for someone who's not having trouble getting pregnant, a lot of like, like the other like kind of supplements and things are like in relationship to somebody who's like, say, going through IVF, and there's like data on like in IVF cycles. So I don't know if there's anything that like kind of like preserves your fertility per se, but the things that do make a difference, obviously, like smoking, like stop smoking, like that makes a big difference, both men and women.
Smoking cigarettes and weed?
Yeah, cigarettes and marijuana, I think, like I don't know the exact data off the top of my head, but there is potentially an impact. But definitely cigarette smoking, like, nicotine type products. And then, alcohol intake, obviously, just, like in moderation and things like that. For men out there, interestingly, a lot of people may not realize things that like raise the temperature of the testes. So, like hot tubs, like tight pants, like anything that kind of like puts the, testes like closer to your body where it's hotter. So, and also a lot of like the supplements and stuff for like the bodybuilding and that, like testosterone, like they actually, if you don't need it, if you don't actually have like low testosterone, sometimes people will take testosterone for, like not just making you go up to a normal level of testosterone purposes that actually decreases fertility. So Dr. Natalie Crawford is a great one to follow for this, because she has a lot of like evidence-based. She's a fertility doctor who does a lot of social media. She has a great YouTube channel. So she does a lot of talking about, like the coenzyme Q, like the different things you can do to help with your fertility. And she gave a great example. And this is like the danger of the, like, I listened to like some wellness expert who's not actually a fertility expert who told me I needed to do these things. So she said she had a couple that came in, and this is such a good like learning experience. The male partner was on testosterone and the female partner was on progesterone, because they said that she like, someone told her that she was like progesterone deficient, so she needed to be on progesterone. They are both basically on birth control. Like that, like makes it, the testosterone affects like, male fertility, and then the progesterone can keep you from ovulating. And so she was like, this poor couple was like, why aren't we getting pregnant? She's like, because somebody put you basically both on birth control and didn't explain that to you. And so again, like, don't take advice on fertility or hormone stuff from people who are not actual fertility experts.
Or have never seen you in their life.
Right. Yeah. Or like, so just be very careful about that stuff, because, they'll be like, you'll feel like vibrant and like, you're going to like, look more youthful and be stronger. And, but secretly you're actually like hurting your fertility.
No, I've seen those videos.
I know. So that blew my mind. I was like, oh my God,
No, that's so crazy. I can imagine that happens a lot.
Right?
Because yes.
Yeah. It probably happens a lot more than people realize.
Totally. So I'm going to give you a scenario, a very, very, very hypothetical scenario.
Yeah.
But I think that this is kind of everyone's fear. Not that anyone lives their life this way, but let's just say someone that loves to have a good time, they have been on a cocaine bender for 10 days. You know, they do cocaine off public bathroom floors. They've been drinking nonstop.
Yeah.
They are on Adderall and Xanax and a bunch of other, antidepressants or antipsychotics. They are smoking weed every night, whatever it is. Let's say that person gets pregnant. They had sex with their partner that night. They got pregnant. Is that baby going to come out like a gremlin? Can a baby come out healthy, even if your lifestyle before is not healthy whatsoever?
Yeah. And obviously my caveat is going to be like, please don't go on cocaine benders.
No, please do. And just tell us all about it later.
Yeah. But just to say that, it's actually pretty common. And this is where in the abortion discussions about what the gestational age cutoffs are, a lot of people don't know that they're pregnant until they're 6 to 8 weeks along. What that means, because again, a lot of people don't realize, is that's the time from the first day of your last period. It's not that you conceived 6 to 8 weeks ago or you had sex 6 to 8, that's just the since the last period.
That's an important distinction.
Very important, because 4 weeks is when your period would be due. Almost nobody knows they're pregnant, if they're not expecting it right when their period's due. It might be, my period's a week late, then they get a pregnancy test a couple of days later. So, usually it's in that time frame of 4 to 8 weeks that someone even finds out that they're pregnant. And that's common. So many pregnancies are unplanned, and people may have been drinking, they may have been smoking, they may have been taking medications that normally we would stop in pregnancy. So it's not uncommon. Very, very early in pregnancy, those first couple of weeks that, embryo is developing, there's no shared blood supply yet. So a lot of people are like, I did this thing, but the likelihood of it really kind of even getting to the embryo that early is very low. You're not sharing a blood supply with the embryo yet. So, obviously, as soon as you find out, you stop the potentially dangerous stuff, you go see your doctor. There are some things that we are very careful about. So this is somebody who's on Retin-A, or there are certain medications that have a really high potential chance for pretty bad fetal birth defects, things like really, really poorly controlled diabetes, because super high blood sugar can cause birth defects. There are some things that we're actually, there's a real strong chance this could be not a normal pregnancy, and you may want to terminate the pregnancy. So there's a few circumstances where we're even very early on that we're the chances are higher that there's some, but like I said, something that's kind of, passed through the bloodstream, a medication exposure, most, things like alcohol exposure, the likelihood is low. So obviously you would talk to your doctor. Every circumstance is different. I always tell you, don't say Dr. Tang said it was cool and then just forget it. But,
yes, please don't do
but just to put people's mind at ease, that it's fairly common for people to have been drinking, didn't realize, find out they're pregnant when they're 6 weeks along, be oh my gosh, what did I do? So that's not uncommon.
Okay. Now that makes me feel a lot better.
Yeah.
I just feel like it comes with motherhood as well. It comes with, you just feel like there are so many ways to mess up. And then I think the real evolved learning is that it's hard to mess it up that badly.
Yeah. I'll actually give you the example, and I tell people this just to make them feel better. So I, planned my first pregnancy. I was at the end of my residency. I fully knew all of this stuff. And I had what must have been just implantation bleeding, because I thought I had a period. I was okay, it's my period. Yeah. And then we took a trip to England, and I drank beer. I went to Bath, and I was in the hot tub. You're not supposed to be in the super hot temperature. I had unpasteurized cheese, all the things you're not supposed to do. And then we came back, and I was oh, where's my period? And then it turns out I had been 4 to 5 weeks pregnant when all this happened, because I thought it was a period, but it was not. So, even somebody who does this for a living, it can be confusing. Yeah, it can be confusing. And so, it's definitely not no one's going to be oh my God, you're the only person who's ever done this. Lots and lots of people go through the same thing, because it's confusing.
Who probably have worse habits than you, in a lot of ways.
Yeah,
okay. No, that makes me feel a lot better, because I think there's just so much fear mongering. What I really get a lot in my DMs, I have to be honest, and I post about it a lot because I think it's so funny that we all do this. A couple days before my period, if I've had even just we can discuss the pull-out method later. But, if I've had like somewhat unprotected sex, without fail, I will Google 7 times, is this a period or is it, am I pregnant? Is there anything that you can offer this community that is like a telltale difference? Because I know your boobs hurt both times. It's like, is there anything that might be different?
Yeah, it's tough because obviously there's no way to know. And there are like sometimes the PMS symptoms are symptoms of pregnancy.
Yes.
And so, moodiness, breast tenderness, bloating, all that stuff. So yeah, there's nothing that I can kind of clearly say. Yeah. But like obviously take pregnancy tests. So I tell people like, if your period is weird or missing, like, take a pregnancy test. You have to take it like every single day, but like, a couple of days, like once a week, until either your period shows up or something shows up pregnant, and if you are confused anyway, obviously see your gynecologist. That's what they were there for. You can always get a blood pregnancy test, just to kind of put your mind at ease, like that sort of thing. So yeah, that's what, your doctor's there to help figure out the mystery of it all.
Yes.
Like, I don't know. Yeah.
I do it every month and I just know like so many people do. Okay. So if someone is getting tested just really quickly, what is the most important level? Let's say they just want to know what to ask for.
Oh, for fertility testing?
Yeah.
Yeah. So the things that we usually check are like the ovarian, call them ovarian hormones. So estradiol, which is like the estrogen level, and also FSH and LH, which are signals from the brain. If someone's actually going through either ovarian failure or what we call hypothalamic amenorrhea, which is like the stress, like the other stuff that can throw off the signaling, you can see it in the level of the FSH LH. And so that's what that one is for. And then if someone's having symptoms of, like PCOS, high testosterone, we may check testosterone levels. There is something called, I do want to mention this, there's something called AMH, anti-Mullerian hormone, like people may have heard of. We always have to caution, people think that it's a fertility test, like that tells you how fertile you are. It's actually only specifically been studied in the context of IVF and to say like, how your response to IVF will be. So if you have, a really abnormal level, it could mean that your IVF response may not be great. So it isn't like meant to predict like, oh, you're not even trying to get pregnant. Like how fertile are you? How many eggs do you have? It's actually not meant for that. So I always tell people like, when you see on social media, like ask for AMH so you can tell how fertile you are. Like, like we don't actually use it for that. I know.
Oh my God. You guys, when I said her book changed my life, I really meant it. Like you are just hearing me be set free.
Trying to bust all the myths all over the place. Yeah.
Yes. Yeah. Oh my God. Okay. That's amazing.
And that's the point is because, like people don't know. I mean, again, I had to do a whole ovarian residency and practice gynecology for 14 years to learn some of this stuff.
Right. So. And then I'm sure when you actually had your kids, you had to learn even more.
Oh, yeah. And it's totally different when it's you going through something. Because like I said, clearly, even though I had the book learning about pregnancy testing and like symptoms of pregnancy, like I was confused too.
Completely.
The bodies are weird, but sometimes bodies don't follow the rules that you expect
most
them to.
Of the time.
And so it can be very confusing. Yeah.
Oh my God. Can I just ask you, frankly, like, can we do this again sometime? Because I have even more questions for you. This was
I always tell people, like, it's hard to cover everything anybody wants to know, like in 1 hour. There's so many different things.
No, I appreciate you sticking with me.
Oh, of course.
There were so many questions I threw at you, but you are unbelievable. Are you in LA? Where's your practice?
No, I'm outside of Philadelphia. I know. People get very confused as to where I am. Yeah, so I'm outside of Philadelphia, but I will be in LA actually in October. I'll be for those listeners at the Zibby bookstore in October. I have to look and see the exact date.
Okay, I'll put it in the show notes.
Exactly, that'd be perfect.
Thanks for doing this.